So it's really great to be here today. My colleague Carrie Sykes should have been here, but unfortunately she's not able to. So I'm a senior family care advisor in the Children and Young People's team in the Learning Disability and Autism programme. One of my children is autistic and has a learning disability. And my background is really in co-production, and I'm a founder member of the National Network of Parent Carer Forums. Next slide, please. So it's really great, as Dave said, to have a focus this afternoon on children and young people and the work that we've been doing since the launch of the STOMP element of the programme a few years ago. So these are some of the things that I'm going to be covering today, what we've done so far, some of the aims and principles, reminding ourselves about those, what we're currently doing, and some wider work to reduce inequalities, focusing in particular on physical health, and that we've heard a lot about this morning. Next slide, please. So if you may remember, if you've been involved in this work and following it, that we've obviously had our STOMP programme and wonderful people like Carl and others involved in that for a very long time. But the STOMP element of the programme, focusing in particular on children and young people, came slightly later. And that was launched in 2018 with our partner organisations, including the Royal College of Paediatrics and Child Health. And I happened to be there myself at the launch of our STOMP programme at the Royal College, with many wonderful parents, young people, and the Royal College, Council for Disabled Children and others. And the reason that we had another term, supporting treatment and appropriate medication in paediatrics, reflected discussions with those partners. They felt, as paediatric specialists, that they wanted a focus on understanding the importance of supporting the treatment and therefore that treatment being available. And we've heard about some of that again this morning, therapeutic support for children and young people. So they wanted a particular focus on that and to draw out these elements that they felt were very important to focus on in paediatrics. Next slide, please, Zara. So this is just some of the, the elements around the needs of children and young people. And I've talked to some psychiatrists myself, although I'm not a clinician, and know that many of the medications that are prescribed that are psychotropic for children and young people are actually not often tested on children and young people. They're largely adult tested medications. And so I think there's a huge issue around that and more generally. But where medications are prescribed in childhood, they often continue long past the original prescribing rationale. And I think we've seen some very good illustrations and examples of that from Naget's work and other work. And there are different reasons for that, but I think it's so therefore we need to be very, focused on the needs of children and young people and that aspect about the treatment element and the the therapeutic support that children and young people need, including having their needs identified around language and communication, around sensory needs, understanding the impact of sensory environments, other physical health needs, and also the whole issues around sleep. Children and young people may at times be seen challenging to others, and often psychotropic medication is in those circumstances inappropriately prescribed because of a perceived lack of readily available alternatives. And just in my own case, in my own son, as an example, his first diagnosis that we ever had was that he had challenging behaviour. He was 4 years old, but actually what we didn't know, but we found out ourselves through private speech therapist, was he had language and communication disorders, and we found out later he has got very complex sensory processing disorders. So I think when you see a child and people are using words like challenging, those are really the wrong words to be using. These are children, human beings, who need to be understood, their autism understood, their language and communications understood, and all their other needs understood. Clinicians, families, carers should work together to find alternatives, such as positive behaviour support. And as I said, I'm a great believer in co-production and working with families, children and young people, individually and strategically is really important in all of this work. At the same time, we know that for some children and young people, medication can be useful in enabling them to function and help them achieve their potential, but regular and timely reviews should be undertaken so the effectiveness of the medication is clear and balanced against potential side effects. So parents who were involved in the STOMP element of the work really felt that for them, the key things were children and young people are only getting the right medication at the right time for the right reason. Next slide, please. So the aims and principles of the work are to make the lives of children and young people who are prescribed medications better, to make sure that children and young people who need medication get it for the right reason in the right amount for as short a time as possible, and help people to understand more about the medications and have the confidence to ask why they are needed. And that includes, clinicians in primary care and elsewhere, but also families and indeed the children and young people themselves. Next slide, please. We also need to see more non-medication treatments and support available. So, I talked just now about the vital importance of speech and language therapy, of occupational therapy, especially understanding the sensory needs, but also, we've talked as well about physical health. Physiotherapists are really important. My son suffers from Ehlers-Danlos loss, the hypermobility type. That has had a huge impact on his life. His difficulty in walking, suffering quite a lot of pain and discomfort, putting him at risk of reflux and constipation. So I have myself really tried very hard to get the best therapeutic support for my son and work really hard to make sure that all of these non-medication treatments and support are available. And I guess I would just say that, we don't want families to all have to work so hard. That would be great if, as Nigette was saying, we look at the commissioning roles and others advocating for the right services for children and young people and their families, so that they get the best care and support at this very important part of their lives. Again, making sure that the person, the child, their family are involved in any decisions to start, stop, reduce, or continue taking any medication. And we're also incredibly committed to the vital importance of annual health checks for children and young people starting from the age of 14. So we have quite a lot of information about STOMP on our website, and we've got some really wonderful videos that were taken on the day of the launch from families. We've got Sarah and Owen here, but we've got many others. You can see these wonderful videos, information about the pledges, videos of how medication has affected children positively and not so positively, and families' lives, and also the resources that are available and what, importantly, the NICE guidance says about this whole area. Next slide, please. Nigette touched on these earlier this morning, but it's important in all of this work, and hopefully today you can take these away, that we've already got some really good resources for families. We've this online medication pathway resource co-produced by the Challenging Behaviour Foundation. It's a wonderful resource that I've used it myself. And we've also got a great resource for families that was co-produced, helping families to understand all about medication and questions to ask of professionals. Next slide, please. So this is what can you do here today, listening to this presentation and showing your great commitment to this work and caring for our children and families by joining today. You can commit to STOMP and STAMP and be a champion. Understand psychotropic medication should not be used instead of support and therapeutic treatment. And just to give an example of that for my son doesn't sleep very well. Initially, he was prescribed melatonin a lot. Over time, I asked for that to be reviewed. He came off that medication. They decided it now didn't make a great difference to the amount of sleep. He therefore needs really 24/7 care and support, so that people are with him when he wakes up in the night and he needs help. So that's an example of, medication not being used inappropriately, but it recognizing that that has a consequence for the right support that children and young people need. Vitally involve children and young people and their families in decisions and in training. Ensure that children get medication reviews and other support. Make medication reviews part of the annual health checks. Avoid labels like challenging behaviour. It's really all about the person's unmet needs, their communication and other needs, understanding autism and all of that. And get advice from a pharmacist who understands STOMP and STAMP and work with other professionals to do your best for these children and young people and check you're making a difference. And I think we've just heard some wonderful examples from Rohit and from others today about how this can be achieved in wonderful work that's been done. Next slide, please. So these are some of the things we're doing now. We're conducting an audit of children and young people within a calm setting, gathering their views about medication. There are 3 pilot sites. Funding 2 sites in Derby and Morecambe Bay to increase awareness of the uptake of annual health checks for 14 to 17-year-olds. Preparing to launch an initiative to increase awareness of annual health checks among young people nationally. Looking at alternatives to medication for sleep and producing guidance for children and young people by children and young people themselves. Next slide, please. So we heard this morning from Hazel, and she talked about Paula McGowan, and it's really important, I think, in all services to think about how you listen as commissioners, as services, to the voice of children, young people and families. And we created something called Ask, Listen, Do that reflects the need to do this really well across education, health and social care for children, young people and adults and their families. We've got free resources. I know that Joe Whaley, my colleague's been posting these in the chat that are available to help you with this. But this is just some of the words from Paula about on our blog, on our website, about the importance of listening. My family and I challenge healthcare providers to ask people for their opinion and concerns, to listen to all involved and show respect for those opinions and concerns, and do something about it in partnership with us. Put people at the heart of decision making, respect our point of view, don't make decisions without us. Enable us to understand complex decisions and do everything in your power to prevent a story like Oliver's from happening and being told again. And I think we've heard, from Hazel and all the other stories this morning about how we need to listen and care for these children and young people and hear their voices and help them to have great lives. Next slide, please. So these are some of the principles of Ask, Listen, Do, and sometimes it can be hard to know if your feedback, concerns, complaints, safeguarding systems are actually working and hearing these voices. And we heard a lot of talk today about reasonable adjustments. Well, reasonable adjustments don't just apply in relation to what we talked about this morning, which are absolutely vital, but it also applies in relation to how organisations and systems are listening to and hearing the voices of children and young people who are autistic, have a learning disability and their families. And we know from the work of Ask, Listen, Do that these systems of feedback, including the friends and family test, concern systems, complaint systems, don't necessarily work as well as they should. And the experiences of this group of children, young people and adults is poorer and needs to be better. So these principles are really about not being defensive, about valuing those voices, really listening, knowing your feedback, concerns and processes are hearing the voices and really learning from that. And I think, Rohit really showed how even when complaints are made, that, it's important to understand people's perspectives and worries and concerns and really work positively through that, a sign of great leadership. Next slide, please. We've got some great resources. They're all free. You can use them. We have resources for autistic people that they co-produced for themselves. We have resources for people with a learning disability. We have training videos. We have resources for families and carers about the importance of knowing you can hear your voice. You have a right to have a voice. Feedback, concerns and complaints are important to improve experiences, important to have good communication. Next slide, please. So another piece of work in my programme that I have been involved with, along with others, is something called Seldom Heard Voices. And as with my own son, not everybody communicates in words or can even actually understand the words that you're saying. My son has receptive and expressive language disorders, a severe learning disability, as well as being autistic. Therefore, he can't actually understand most of what I say or what anybody says, and certainly has no understanding of complex concepts. So I would say half of the population, at least in this group, will not be able to understand what you're saying in words or be able to communicate and express what they feel or want to say in words. So we need to hear from and understand people who communicate in ways that are personal to them and are not easily recognised by others. They will not be in meetings that you may have. They won't be at consultations or events. We have commissioned the Challenging Behaviour Foundation, Speak Up Self-Advocacy and Sparkle Sheffield to lead work for our programme in listening to the voices of children and adults in this group. We will share that learning and make tools available. Some of the work is already available on the Challenging Behaviour website, but I think it's really just so important to understand that not everybody can communicate in words, and we need everybody's voice to be heard. Every voice matters. Next slide, please. So the NHS long-term plan talked about and has committed us to, these are some examples of our long-term plan work: hearing, sight and dental checks for children, young people with a learning disability, autism or both, in special residential schools. And I would say here that undiagnosed physical health needs in these areas can be wrongly seen as challenging behaviour or unmet mental health needs. And through this work, I have heard stories of children and young people who have been at risk of being or sent into mental health settings because they have toothache, they can't see, or they've got something wrong with their hearing. Next slide, please. So I won't go through all of these. This information is available on our website and I encourage you to look at. We've just had a new section on the sensory checks work set up on our website. But I don't know if you know, and you would like to be aware, that hearing loss in children and young people in this category is 10 times higher than in other children and young people. Autistic children and young people, including like my son, are very likely to have a condition called glue ear. It's very painful. They may not be able to say it's causing pain and distress and exhibiting behaviours. So it can contribute to speech delays, language delays, and impact other things. It's really important that we have hearing checked and make sure they have the right support. Next slide, please. Sight checks. Children and young people with a learning disability or who are autistic are 28 times more likely to have serious sight problems than other children. Despite this, by the work Seeability have been doing that have really led this great work, 44% of pupils in special schools have never had a sight test. This work is aiming to make sure that happens. That's a picture of my son Alex. I took Alex recently to a very wonderful service that has reasonable adjustments for autistic and learning disabled young people, and we found out he needs glasses. He's very happy with his glasses. He loves his glasses. Nobody knew he needed glasses and he couldn't say. So just to say how wonderful it is so people can see. Next slide, please. Dental checks. Again, this group of children and young people have very, very high levels of untreated tooth decay. We know a healthy mouth is important for, sleep, talk, play, their overall well-being. And again, there are huge barriers. The reason these issues are identified and in the NHS long-term plan is because, in effect, I would call it a market failure in universal services. These children and young people are not just getting the treatment that they need and the support they need. And we have to address and identify that So, and hopefully we are going to see improvements in all of these workforces in understanding the needs of these groups of children, young people and their families. Next slide, please. So I just wanted, I know this is a bit small, but it's a quote. These are actually extracts from the new national strategy for autistic children and young people and adults, 2021 to 2026. So in addition to all those things that I spoke about, we're also, through the NHS long-term plan, investing £25 million in building capacity and capability of 7-day specialist multidisciplinary and crisis service for autistic people and people with a learning disability. And these are pieces of work that are going on now. They should be in every local area. If you don't know, you might want to ask and find out more. We're investing £15 million in key worker pilots and early adopter sites. The key working work is really innovative. It's making a huge difference. It's a wonderful piece of work. Great to be involved in it. We're investing £3 million in respite and short breaks after COVID-19 with the aim of reducing admissions of autistic children and young people to mental health settings. We're investing £4 million to roll out the Transforming Care Accelerator programme within schools with the aim of reducing exclusions and preventing avoidable admissions. So that's just a summary of some of the wonderful things that are highlighted in the National Strategy with Autistic Children. Thank you very much.
Mary, thank you so much for that really powerful presentation. Some very key messages that build on everything we talked around this morning, around the need to consider the holistic well-being of people, including children and young people, and the real clear challenge to think about listening to people and capturing voices in any of the work that we do. So thank you very much.